Okay, let's dive into this. We're going to tackle a topic that a lot of us have heard about, but maybe don't know the full story on umbilical hernias. It's actually a pretty fascinating look at how our bodies are put together, right from the very beginning.
So let's start with something you've probably seen a million times. We've all wondered about it, right? What's the real story with an outie belly button? Is it just a cute little quirk, or is there something more going on under the surface? Well, that simple question is the perfect way to get into what we're talking about today. So what exactly is an umbilical hernia? Well, basically, it's when some internal tissue, usually a little piece of the intestine, pokes through a weak spot right where the belly button is. That spot is called the umbilical ring. And this can be something you're born with, or it can be something that shows up way later in life. And that difference actually brings us to the two main types you need to know about. There's congenital, which means you have it at birth, and then there's acquired, which means, you guessed it, you get it over time. Knowing the difference between these two is really the key to the whole thing. It's a pretty straightforward comparison, right? On one hand, you've got congenital hernias. We see those in infants right from the get-go. On the other hand, you have acquired hernias, which pop up in adults and tend to develop slowly over time. Two very different paths for the same condition. So let's start with that first category. When we're talking about newborns, an umbilical hernia is actually super common. And for the most part, it's a pretty straightforward situation. Okay, so here are a few key things to know about these infant hernias. For one, they're seen more often in infants of African descent. That little bulge you might see, that's typically just a little bit of the small intestine poking through. But here is the most important part. Complications are really unusual. And this is the piece of information that every parent needs to hear, because the body usually has its own plan. This quote really says it all. They close spontaneously in most cases. In other words, the body just fixes itself. Pretty cool, huh? So when does this natural fix usually happen? The magic number to keep in your head here is 2. Yep, most of these hernias that babies are born with will close up all on their own by the time the child turns 2. So let's just walk through that timeline. A baby might have a visible hernia right at birth. The standard game plan is just to watch and wait because, like we said, by age 2, it's usually totally gone. It's only if it's still hanging around after age 5 that doctors even start to think about surgery. So surgery is definitely the exception, not the rule. Okay, so let's completely switch gears now. Let's talk about the other side of the coin, the acquired hernia, the one that can show up when you're an adult. For adults, things look a little different. These hernias are actually more common in women, and look, while any hernia has some risks, it's really important to know that a serious complication called strangulation, that's where tissue gets trapped and cut off from blood, is pretty uncommon with this type. Which leads to the obvious question, right? If you weren't born with it, why on earth would that spot on your abdomen suddenly give way later in life? What's going on there? Well, it really all boils down to one thing: pressure. We're talking about things that increase the pressure inside your abdomen over a long period. Think about things like pregnancy, obesity, a condition called ascites, which is a buildup of fluid, or just any kind of long-term abdominal swelling. All that pressure can strain that weak spot at the belly button until something finally pushes through. Okay, so whether we're talking about a kid's hernia that just didn't close or an adult's that just showed up, what's next? Let's get into how these are managed and what the path to repair looks like. This is probably the number one question on anybody's mind when they hear the word hernia. Is surgery a sure thing? Well, the answer might actually surprise you. It's no. You know, the first rule here is actually pretty simple. If the hernia is tiny and it's not causing any symptoms, no pain, no discomfort, then the plan is usually just to leave it alone and keep an eye on it. No surgery needed. So when do doctors start talking about surgery? Well, it usually comes down to 3 main triggers. Number 1, it starts causing symptoms like pain. Number 2, you can see it's getting bigger over time. And number 3, if that rare complication we talked about, incarceration, happens, where tissue gets stuck. And let's say surgery is the right move. Deciding how to do the repair is also pretty logical. It really just comes down to the size of the hole, or the defect. If it's a bigger one, we're talking over 2 centimeters, surgeons will often use a special mesh to make the repair stronger. If it's small, a simple stitch-up is usually all it takes.